All right, so now that we have our preterm labor, we're gonna go on to our next step here and figure out what are we gonna do about that. All right, so this client's showing signs of preterm labor, and because of that, what are we most likely preterm labor based on all of our findings that are given are known. So now we need to determine what 2 actions that we need to take in order to help this client in preterm labor, okay? So generating solutions. This is where we decide what we need to perform or prepare to perform. So our nursing process comes into play here, right? Our ADPI, we're going to assess, diagnose. Now we're going to do this planning and implementation. You guys are already jumping ahead. I see cervical dilation. Y'all are on it. Okay, so remember that the NCLEX is a safety exam. So we need to find actions that we're going to take to keep the client safe in this situation, right? And this is a select end. So again, we're selecting 2 options. So we want interventions that are going to slow or stop the preterm labor and things that will assess for labor, right? So that helps if you can determine ahead of time, what's my overall goal? And then you can look at each one separately. Okay, so QBL, quantify blood loss. What do we think about this? When would we quantify blood loss? When the placenta detaches, we would, anytime there's a lot of bleeding, anytime there's bleeding, we're watching how much is happening. So this would happen in an abruption, it would happen in a hemorrhage. We'd be watching that, right? But is getting the quantified blood loss, she's only had a little bit of spotting, right? So it's not super concerning. And if we quantify the blood loss, that's not going to help us with these goals of slowing or stopping labor. It's not going to assess for labor, right? So while we might do all of these things, we want to pick the best 2, right? Which always makes it tricky because yes, all of these could be possible options that we would do. All right, so let's look at our next one, assess for uterine contractions. Do we want to do that? I've seen lots of people say this. So assessing for uterine contractions, we can put that client on an external monitor, those TOCO it's called, to assess the contraction pattern and frequency, right? Because we want to know, is she contracting? Are these cramping feelings that she's having, are they uterine contractions? So I definitely think this would be a helpful intervention for us to do. Our next one is prepare to administer nifedipine. What do y'all know about nifedipine? What is nifedipine? More importantly, what is nifedipine in the OB world when you're in preterm labor? So nifedipine is a blood pressure med, right? We give it as an antihypertensive. But if you are in labor, it's what's called a tocolytic. And tocolytics are going to slow or stop uterine contractions, right? So that is going to help us stop or delay this preterm labor. So I have 2 options here, but of course we need to always look at our other ones just to make sure. Prepare the client for an abdominal ultrasound. All right, so I saw some people were thinking that. Now, again, not that it's wrong to do, right? It can tell us how the baby's doing, especially if we were worried about an intrauterine fetal demise. It can assess where the placenta is, but that's not going to help us slow or stop this labor or assess for labor, right? So although it won't hurt anything, it's not going to be what we complete here. All right, our last option, prepare the client for a ventilation perfusion scan. Okay, when do we do this? What does this assess for? Obviously, it says, right, we're assessing for ventilation and perfusion in the lungs, those 2 parts of oxygenation, where air has to get in, that's ventilation, and then oxygen has to get to those red blood cells, and that's perfusion. But, and there's different diseases that we do this for. So let's look at this image here just to help explain this VQ, or this ventilation perfusion matching. So the first image on the left shows that we have a problem with ventilation. So anything that prevents the air from filling those alveoli, reaching the capillaries, such as fluid. So that could be like pneumonia. And then the image on the right is going to be, this is where we have a perfusion issue. So like a PE, it's going to block blood flow from reaching those capillaries. And what happens is then the lungs won't get oxygenated, right? So the client has no breathing and ventilation issues, but the blood flow is stopped, and that's preventing oxygenation to the blood. So a ventilation perfusion scan would help diagnose different things like the pneumonia. It'll look at that, and it'll look for a PE. But remember, we were not concerned that it was a PE. And again, this isn't going to slow or stop labor, right? And it's not going to assess for labor. Okay, so take action. What did we decide? What are we doing here? We're going to do prepare to administer nifedipine, our tocolytic, and we're going to assess for uterine contractions, right?